Are you embarrassed to take off your shoes because of your cracked heels? Maybe you've tried every home remedy you could find online: coconut oil, pumice stones, even duct tape, but your heels still look like dry riverbeds. If you're frustrated with cracked heels that just won't heal, despite everything you've tried, you're definitely not alone. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas, with over 25 years of experience treating foot and ankle problems. In my practice, I see patients every day who are dealing with painful, unsightly, cracked heels that have become a source of embarrassment and discomfort. Today, we're going to debunk the most common myths about cracked heels and discuss what actually works to heal them permanently. I'm going to share the truth about why most home remedies fail, what's really causing your cracked heels, and most importantly, the proven treatments that can give you smooth, healthy heels for good. Before we get started into the real solutions, I want you to know that if you find this information helpful, please like this video, hit the subscribe button, and share it on social media. This helps others who are struggling with foot problems find the relief they need. Also, if you're dealing with cracked heels or any other foot problems and want professional evaluation, the link to schedule an appointment is in the description below. Let's start by clearing up some major misconceptions about cracked heels, because these myths are actually preventing people from getting the help they need. The first myth I hear constantly is that cracked heels are just a cosmetic problem and don't need treatment. This couldn't be further from the truth. While cracked heels might start as a cosmetic concern, they can quickly become a serious health issue if left untreated. When the skin on your heel becomes severely dry and starts to crack, these cracks can deepen over time. Deep cracks can lead to bleeding, pain, and most concerning of all, infection. These cracks essentially become open wounds that provide an entry point for bacteria. For people with diabetes or compromised immune systems, cracked heels can be particularly dangerous. What starts as a simple crack can develop into a serious infection that's difficult to heal. I've seen patients who ended up hospitalized because an infected crack on their heel led to a cellulitis, a serious skin and soft tissue infection. The second myth is that cracked heels are contagious. I want to put this fear to rest right away. Cracked heels are not contagious. You cannot catch cracked heels from someone else, and you can't spread them to others. Sometimes people confuse cracked heels with athlete's foot, which is a fungal infection that can be contagious. But cracked heels are simply the result of dry, thickened skin. They're a mechanical problem, not an infectious one. The third myth is that only people with dry skin get cracked heels. While dry skin certainly contributes to the problem, cracked heels can infect anyone regardless of their skin type. The condition results from a combination of factors including prolonged standing, excessive pressure on the feet, certain medical conditions, and yes, dry skin. But it's not limited to people with dry skin. The fourth myth is that cracked heels are caused by a lack of hydration. While moisturizing is important, simply drinking more water or applying lotion isn't going to solve the problem. Cracked heels are caused by multiple factors, and addressing hydration alone won't fix the underlying issues. Finally, there's the myth that cracked heels are only a concern during the summer. This is completely false. While we might notice cracked heels more in the summer when we're wearing sandals, the condition can occur year-round. In fact, winter's dry air and indoor heating can be just as harsh on your feet as summer heat. Now that we've cleared up these misconceptions, let's talk about what actually causes cracked heels. Understanding the real causes is crucial to effective treatment. Cracked heels occur when the skin on the bottom of your feet become excessively dry and thickened. Think of it like a piece of leather that's been left out in the sun. It becomes hard and brittle, and eventually starts to crack. Several factors contribute to this process. Age is a significant factor. As we get older, our skin naturally becomes drier and less elastic. The fat pads of our heels also thin out over time, providing less cushioning and making the skin more prone to cracking. Prolonged standing, especially on hard surfaces, puts constant pressure on your heels. This pressure causes the skin to thicken as a protective response, but thickened skin is more prone to cracking. Certain medical conditions increase your risk of developing cracked heels. Diabetes affects circulation and can cause nerve damage that reduces sensation in your feet. This means you might not even notice the early signs of cracking, allowing the condition to progress. Thyroid disorders, eczema, and psoriasis can also contribute to dry, cracked skin. Footwear plays a huge role. Open back shoes like sandals and flip flops don't provide support for your heels, allowing the fat pad to expand sideways under pressure. This expansion can cause the skin to crack. Ill-fitting shoes that don't provide proper heel support can have the same effect. Obesity increases the pressure on your heels, making cracking more likely. The extra weight causes your heels to expand further when you stand, putting additional stress on the skin. Environmental factors like low humidity, hot weather, and exposure to harsh soaps or chemicals can dry out your skin and contribute to cracking. Now let's talk about why most home remedies fail. I see patients all the time who have tried everything they found on the internet, but their heels are still cracked and painful. The problem with most home remedies is they only address the surface symptoms, not the underlying causes. Applying coconut oil or petroleum jelly may temporarily soften the skin, but doesn't address the mechanical factors that cause the cracking in the first place. Many home remedies also focus on removing the thickened skin rather than addressing why it became thick in the first place. Using a pumice stone or foot files can actually make the problem worse if not done properly. Aggressively filing can damage healthy skin and cause the body to produce even more thick skin as a protective response. Some home remedies can even be dangerous. I've seen patients who try to cut away thick skin with razors or other sharp objects, leading to cuts or infections. Never use sharp objects on your feet. This should always be left to professionals. The key to successfully treating cracked heels is addressing both the symptoms and the underlying causes. This requires a comprehensive approach that goes beyond simply moisturizing. Let's start with a proper assessment. Not all cracked heels are the same, and the treatment approach needs to be tailored to the severity and underlying causes of your specific condition. Mild cracking may only affect the surface layers of the skin and can be often managed with proper moisturizing and footwear changes. Moderate cracking goes deeper and may cause some discomfort, requiring some intensive treatment. Severe cracking can become painful, may bleed, and require professional intervention to prevent complications. The first step in treatment is always proper debridement, the removal of the thick, dead skin. This should be done by a podiatrist who can safely remove the excess skin without damaging the healthy tissue. Trying to do this yourself with over-the-counter tools often leads to injury or makes the problem worse. Once the excess skin is removed, the focus shifts to healing and prevention. This is where proper moisturizing becomes crucial, but not all moisturizers are created equal. For effective healing, you need products designed specifically for severely dry, cracked skin. Regular body lotions simply aren't strong enough to penetrate the thick skin of your heels and provide lasting moisture. This is where specialized products like Odessa moisturizing heel sleeves and gel socks come in. They aren't just regular moisturizers, they're medical-grade products designed specifically for treating cracked heels. Odessa moisturizing heel sleeves contain a patented gel lining infused with vitamins, nutrients, and essential oils. The sleeve design ensures that the moisturizing ingredients stay in contact with your skin for extended periods, allowing for deep penetration and healing. What makes these products so effective is the combination of the moisturizing gel and the occlusive effects of the sleeve. The sleeve creates a barrier that prevents moisture loss, while the gel continuously delivers healing ingredients into your skin. This is much more effective than simply applying cream and hope it doesn't rub off. The Odessa gel socks work on the same principle, but treat your entire foot. They're particularly useful if you have cracking or dryness in other areas of your feet, not just your heels. These products are designed to be worn for several hours or even overnight, giving the healing ingredients time to work. Many of my patients see significant improvement after just a few uses, but even the best moisturizing products won't work if you don't address the underlying mechanical factors that cause the cracking. This is where proper footwear and foot supports become crucial. Supportive shoes with closed backs are essential for healing cracked heels. The shoes should provide adequate cushioning and support to prevent excessive pressure on your heels. Avoid open back shoes during the healing process as they don't provide the support your heel needs. Custom orthotics can be helpful for people with biomechanical issues that contribute to heel pressure. If you have flat feet, high arches, or other structural problems, orthotics can help redistribute pressures and reduce stress on your heels. For people who must stand for long periods, cushioned insoles or heel cups can provide additional protection and comfort during the healing process. Weight management is also important if obesity is contributing to your heel problems. Even modest weight loss can significantly reduce the pressure on your heels and help prevent reoccurrence. Let's talk about the healing process and what to expect. Healing cracked heels takes time and patience. The skin on your heels is thick and doesn't heal as quickly as the skin in other areas of your body. With proper treatment, you should start to see an improvement within a few days to a week. The cracks will begin to close and the skin will start to soften. However, complete healing can take several weeks, especially in severe cases. It's important to be consistent with your treatment during this time. Skipping treatments or reverting to old habits can slow the healing process or cause the cracks to return. During the healing process, it's crucial to keep your feet clean and dry. Wash your feet daily with mild soap and dry them thoroughly, especially between your toes. Moisture trapped between your toes can lead to fungal infections, which can complicate the healing process. Monitor your heels for signs of infection, especially if you have diabetes or other conditions that affect healing. Signs of infection include redness, warmth, swelling, pus, or red streaking. If you notice any of these signs, seek medical attention immediately. For people with diabetes, proper foot care is absolutely critical. Diabetes can affect both circulation and sensation in your feet, making you more prone to complications. If you have diabetes and cracked heels, you should be under the care of a podiatrist who can monitor your condition and provide appropriate treatment. Prevention is always better than treatment. Once your heels have healed, there are steps you can take to prevent the problem from returning. Daily moisturizing is essential, but it needs to be done correctly. Apply a good quality foot cream to your heels every day, preferably after showering when your skin is still slightly damp. This helps to lock in the moisture. Regular use of products like Adessa heel sleeves, even after your heels have healed, can help maintain healthy skin and prevent reoccurrence. Many of my patients use these products once or twice a week as a maintenance therapy. Proper footwear is crucial for prevention. Choose shoes with good heel support and adequate cushioning. Avoid going barefoot on hard surfaces and limit your time in open back shoes. Regular professional foot care can help catch problems early before they become severe. I recommend having your feet evaluated by a podiatrist at least once a year, or more frequently if you have risk factors like diabetes. Gentle exfoliation can help prevent the buildup of thick skin, but this should be done carefully. Use a pumice stone or foot file gently and only on damp skin. Never file aggressively or use sharp objects. Stay hydrated and maintain good overall health. While drinking water alone won't cure cracked heels, good hydration supports overall skin health. Let's talk about when you should seek professional help. While mild cracking can often be managed at home with proper products and care, there are situations where professional treatment is necessary. If your cracks are deep, painful, or bleeding, you need professional care. Deep cracks can become infected and may require prescription treatments. If you have diabetes, circulation problems, or immune system disorders, you should always have a cracked heels evaluated by a podiatrist. These conditions can lead to serious complications if foot problems aren't properly managed. If you've tried appropriate home treatments for several weeks without improvement, it's time to seek a professional. Persistent cracking may indicate underlying issues that need to be addressed. If you notice signs of infection, redness, warmth, swelling, pus, or red streaking, seek immediate medical attention. In my practice, I use a combination of professional debridement, prescription moisturizers, and sometimes advanced treatments for severe cases. For patients with recurring problems, we might use treatments like urea-based preparations or even prescription retinoids to help normalize the skin cell turnover. The key message I want you to take away is that cracked heels are a treatable condition, but successful treatment requires the right approach. Simply applying lotion isn't enough. You need products designed specifically for this condition, like the Adessa moisturizing systems, combined with proper footwear and addressing any underlying mechanical issues. Don't let embarrassment or the misconception that this is just a cosmetic problem prevent you from getting the help you need. Cracked heels can significantly impact the quality of your life and can lead to serious complications if left untreated. With the right treatment approach, most people can achieve smooth, healthy heels and keep them that way. The key is being consistent with treatment and addressing all the factors that contribute to the problem. As we wrap up today's discussion about cracked heels, I want you to remember that you don't have to live with painful, embarrassing cracked heels. With the right treatment approach and products like the Odessa moisturizing system, you can achieve healthy, smooth heels. The most important thing is to start treatment early and be consistent. Don't wait until the cracks become deep and painful. Address the problem as soon as you notice it developing. Thanks for taking the time to watch this video. If you found it helpful, please take a moment to like it, comment below with any questions you might have, and share it on social media to help others who might be struggling with similar problems. Be sure to hit the subscribe button so you won't miss future content about foot and ankle health. If you're currently dealing with cracked heels, especially if they're painful or if you have diabetes or other health conditions, I encourage you to schedule an appointment for proper evaluation and treatment. Early intervention can prevent minor problems from becoming major complications. The link to request an appointment is in the description below. Remember, your feet carry you through life. They deserve proper care and attention. Thanks so much for watching, and have a great day.